And I want to thank again the speakers and the chair of the first session, because it was really insightful, and there was a lot of discussion between the different speakers on various topics. So thank you very much. And so now I would like to introduce Nicolas Chateau, Imagineye's CEO, who will talk to you about the new features that are coming for rtx1 adaptive optics retinal camera. So I don't want to spoil his talk, and I will just let him explain.
Thank you, and thank you for the excellent first session. So I won't take long, but I want to inform everyone that we now have a new module for the rtx1 adaptive optics retinal camera. We call it TFI. It stands for transcleral flood illumination. And so this is an optional module that can be attached or fitted to a large number of existing systems. The interest of this module is to provide a slightly different modality for imaging the retinal pigment epithelium. So here you see the rtx1 with the TFI module. So we simply add two projectors in front of the device and some electronics inside to control them. And here you can see the results. So you have a standard rtx1 image of photoreceptors on the left. And here on the right, you can see the TFI image, where the photoreceptors are no more visible, and we see the mosaic of RPE cells. So the appearance of these cells is they have a dark center and a grayish periphery. And in healthy retinas, we find that they have a spacing between cells that is around 14 micron. Okay, so when we fit this module, the machine keeps the possibility to image in the standard way through the pupil, but also it adds the possibility of taking images with the transcleral illumination. So this is how it works. We have two projectors on the side that illuminate the sclera through the pars plana, where it is the thinnest, so that the retina receives oblique light. And in this configuration, the photoreceptors, because of what is known as the Stice-Crawford effect, do not reflect the light, and we can obtain this kind of images. Now, this is a new modality, and as such, it's an exploratory modality. I want to show you an image that I got from Kyoko and Michel's group in Paris. It's an example of the use of TFI in dry AMD. So here you see the conventional infrared SLO image of this case with atrophy and a central sparing. And here the OCT also showing the spared foveal area. This is the standard rtx1 image. So of course the magnification is higher, but here we can see the delimitation between the spared area and the atrophic area. And we can see some preserved photoreceptors in the sparing. And in the atrophic area, as well, Christopher Holmes has shown before, we see a number of clumps of pigments that are present. And yes, there is a follow-up. So, and in the follow-up, we also can see some changes in the distribution of pigment. Now, and you can also notice that these clumps of pigment are located in the atrophic area. Now, when we look with the transcleral illumination, so we don't see photoreceptors anymore, but in the areas where photoreceptors are present, we can distinguish some RP cells that are present too. They are more difficult to see in this area where photoreceptors are also more difficult to see. The limit of atrophy is, I would say, is more difficult to distinguish in this image. But one difference that we see is that we can observe clumps of pigments also in the spared area, and it is something that we observed several times in pathological cases. We can see a higher number of HRCs with the TFI. And in the follow-up, okay, here you can see, if you look at these 3 clumps, they become 2 clumps. So we also see this tendency of aggregating that Christopher mentioned before. So this is all I'm going to show today, but the message is that this module is now available. I think we are going to deliver one very soon in Belfast. It has received the CE mark, and we hope several of your teams are going to use it and bring clinical data and make more new discoveries with this new option. Thank you very much.
Thank you very much, Nicolas, for this very insightful introduction. And so I will let, if anyone in the panel of speakers and chair have questions about it, or if anyone in the audience have some question, please type it in the Q&A. We can take some time to address it before moving on to the second, more scientific session.
So Nicolas, if I may start, and then I'm sure others will have questions as well. So if you're sitting in a clinic, you know, and you have this module, and where do you see, what is the question that most people should be asking? What is the area that we should be imaging the most, and what do you think it will help us with to answer our patients' questions?
You mean what would be the best imaging protocol with this modality?
Mm-hmm.
Well, I think for me it's a bit early to answer you, because we have seen a limited amount of data.
So what would help then? What should we do once some centers have it? What would be the most helpful for both for the clinicians and for you to develop it further?
No, I mean, in pathological cases, I think it's very interesting to look at the areas where there is some kind of transition, you know, from the healthy retina to the lesion, because this is where you have the possibility to see that in the area that looks healthy, the RP has already started suffering. I don't know if it answers your question.
Yeah, so I think that goes into, and then I hand over to Marie-Hélène. How, you know, the question from the audience is, and how could we capture the RP layer? That's
okay. And I see Michelle is probably going to help me to answer you to answer the question. So when you use the system with the TFI option, you can take the regular photoreceptor picture focusing at the photoreceptors, and then you switch to the TFI illumination and take a picture with the same focus. This is where you have the best chance to be in focus with the RP. And the difference that we have technically is that we use a longer a longer exposure for the RPE. So the acquisition time is 6 seconds instead of 2 seconds for the photoreceptors. And this is because the contrast of the RPE cells is much lower. So it's more challenging. But really in this development, we wanted to bring a method for imaging the RP that is feasible in the clinic. Because we have seen in the literature, for example, techniques based on AOCT that were taking much longer acquisition time. So now we could, with this method, we could bring it down to 6 seconds. So it is something that you can use with most of the patients. Perhaps Michel, you want to comment?
I think Imre had a question.
Okay.
Just a quick, well, a coupled question. One is there an inbuilt software package to analyze the mosaic, the RP mosaic, or that secondary, let's say, analysis is still the user's job?
Okay, there is not a built-in software, but we have a non-commercial software that makes it easy to make a manual analysis, to manual counting based on the AO detect interface, and this is something we'll be happy to share.
There is a question about the depth of capture, and I had exactly the same question, because when we want to image the vessel, we go a little bit higher. When we want to have a look at the photoreceptors, we go a little bit deeper. But for this RP cells, shall we just switch for how do you call it, TFI module, or shall we go a little bit deeper?
Okay. The way we set it is that when you are using the TFI module for the acquisition, because the contrast of the RP cells is too low, the live image that we show is acquired with the standard imaging. And so the system has been made so that when you have a good focus on the photoreceptor with the standard imaging, then when you do the acquisition with the TFI, you have the best possible focus on the RPE, which is very close to the photoreceptors.
Thank you. It answered to the question of the audience. We have another hand raised.
May I ask a question? I was surprised myself with the case of AMD and using a TFI. And the most prominent thing I can observe is that it's a very powerful way of detecting pigment aggregates. It seems that the limit between RPE and atrophy is blurred, so you have a higher contrast of these pigmented cells all over the place. So it's these pigment spots are usually easy to see over atrophic areas, but they're much more difficult to see over the persistent RPE. And TFI increases our capability of identifying also additional pigmented cells over the persistent RPE, which improve our phenotypic capabilities in these patients.
Okay, thank you very much, everyone, for participating, asking questions, commenting, discussing. We will stop now for this part.